About 140 million women use some type of hormonal contraception, including about 16 million in the United States. But a large Danish study published Wednesday suggests that, like older pills, they still modestly raise the risk of breast cancer, especially with long-term use. Here's what to know about the new data and the risks. What is the risk? Overall increased risk was small, amounting to one extra case of breast cancer among 7,700 women using such contraceptives per year. Experts who reviewed the research say women should balance the news against known benefits of the pill, including lowering the risk of other cancers. Current and recent use of hormonal contraceptives was associated with a 20% increased risk of breast cancer. Risk increased with longer use, from a 9% increase in risk with less than a year of contraceptive use to a 38% increase after more than 10 years of use. Studies of older birth control pills have shown a net cancer benefit because of lowered risk of cancer of the colon, uterus and ovaries despite a raised breast cancer risk, said Mia Gody, a breast cancer epidemiologist at the American Cancer Society. There was optimism that newer, low-dose contraceptives would lower the breast cancer risk, but these results have dashed those hopes, said Gody, who wasn't involved in the research. Is the risk the same for pills, intrauterine devices, patches and implants? Researchers found a similar breast cancer risk with a progestin-only intrauterine device, and they couldn't rule out a risk for other hormonal contraceptives like the patch and the implant. Digging further, the researchers found no differences among types of birth control pills. Because of fewer users, the results for the patch, vaginal ring, implant and progestin shot were less clear, but the analysis didn't rule out an increased breast cancer risk for those methods. I've been taking these. Should I stop now? Hormonal contraceptives remain safe and effective, said Dr. Joanne Manson, chief of preventive medicine at Harvard's Brigham and Women's Hospital, who was not involved in the research. But women in their 40s may want to consider non-hormonal IUDs, getting their tubes tied or talking with their partners about vasectomy. What are my options? No type of hormone contraceptive is risk-free unfortunately, said lead author Lena Morch of Copenhagen University Hospital. What if I have a family history of breast cancer? Women with a family history of breast cancer may want to ask their doctors about other contraceptives, said Dr. Roshni Rao, a breast surgeon at New York Presbyterian Columbia University Medical Center. Oral contraceptives are like any other medication. Rao said, there are risks and there are benefits. If you have a reason to be taking them, it's perfectly reasonable to do so. How solid is this research? Researchers analyzed health records of 1.8 million women, ages 15 to 49, in Denmark where a national healthcare system allows linking up large databases of prescription histories, cancer diagnoses and other information. Results were published Wednesday in the New England Journal of Medicine. Novo Nordisk Foundation funded the research but played no role in designing the study. The foundation has ties to the Danish pharmaceutical company Novo Nordisk, which primarily makes diabetes drugs and does not make contraceptives. Reader, share this story https://usat.ly/2actal